Hello and welcome to Conversations with Ruth. I am Ruth. I am also known as Notorious RVG. During the time I worked with ACLU, I encountered legal aid attorneys and was always impressed with their dedication and good work. I realized that I do not know much about legal aid of North Carolina. I have wondered what legal aid really is. How is legal aid able to serve all those that are eligible for its services? That legal aid not only provides services in specific areas, but to target populations, such as veterans, seniors, Native Americans, and victims of trafficking. Equally important is what are the services legal aid provides? Well, to answer those questions, I ask that you join me in a series of interviews about getting to know legal aid of North Carolina. I promise you that I and you together, we will learn what legal aid is and what services it provides. Welcome. Today we are going to talk about the Medical Legal Partnership, another special project of Legal Aid of North Carolina. This is a unique project. Legal aid attorneys work in conjunction with health providers, providing legal remedies to reduce the causes of poor health. To tell us about the project, we are joined by Marilyn Morial, supervising attorney of the project. Ms. Morial, thank you so much for being here with us.
My pleasure.
So maybe we should start with how this partnership works and who are the partners.
Thank you. Every legal services advocate within our statewide organization is part of our statewide medical legal partnership program. It is a special project, but it's also embedded within our local offices. The idea of a medical legal partnership came about many years ago when healthcare providers were working with patients who had problems that didn't really have a medical solution, but they might, as you said earlier, have a legal remedy. So children who were not developing, who needed food, and it wasn't, and maybe the remedy was helping people get access to nutrition benefits, or children with asthma where the real issue was cockroaches or mold or other conditions in the home. And so the idea of a medical legal partnership is that we work strategically with our core staff, and that includes attorneys and paralegals and social workers and others within our organization, to work at the top of our license to do what we call team-based care with health professionals in clinical settings. So we partner with small community clinics and hospital systems and even regional health systems who are doing what we as legal advocates call issue spotting, but they call it screening for social determinants of health. And so when they screen their patients and ask questions to determine if people are food insecure or having problems with their housing or need assistance around interpersonal violence, we are now part of their team to help them get better outcomes for their patients. And they remain part of our team. So it's not just that they're screening, they're assessing what families need, their patients and families need, and then determining which resources within local communities are the best partners. And sometimes that's legal services advocates.
And how do the providers, the health provider, know how to contact you, how to make those referrals to you?
We say that we provide the same, we assist the same folks, the same eligibility criteria, the same statewide priorities as the rest of legal aid of North Carolina. What's different is we're integrated into the clinical settings. We're part of the core team that's usually providing care management services. So we work oftentimes with care managers who are connecting patients to all kinds of resources, including us. So there's capacity building, both on our end and also on their end, because it really changes when you work collaboratively as part of a team with other professionals. It changes how we do our work and they do our work.
So let me see if I am following this well. someone comes because a child in the family has some nutritional needs, and the doctor or the nurse discover that they're not getting food stamps. Mm-hmm. Is that where you come in to resolve that legal issue, for example?
It may be, but we need to back up just a little bit. Sometimes people don't know about WIC or SNAP or other nutrition benefits. And those healthcare providers are the first line to provide information about resources that many people just simply don't know about. If patients or families have applied for benefits and benefits have been denied or terminated or reduced, now we might have a legal remedy to help with the appeal for those things.
Right. And you mentioned that the eligibility criteria is the same as any other client for legal aid.
That's right. And so when we get referrals from our medical legal partnership counterparts or colleagues within the clinical setting, we don't handle things simply because they send us a referral. It has to fit within our statewide priorities.
And those eligibility criteria include financial eligibility.
Absolutely.
And that's
right.
That's done at the local legal aid office?
We have dedicated intake staff to handle the MLP referrals, and this is why. It's really part of that integration model, the idea that if someone sends us a referral, we can close the loop. We can get back to the person who sent the referral and say, we can't find John. And she'll say, well, gosh, he's homeless and he doesn't have a phone, but he'll be here next Tuesday. How about if we try and make that connection? Or if we don't, anyone who makes a referral to any kind of medical specialist wants to know if the patient got there and got what he or she needed. So we close the loop, and then it's not just a direct referral. We continue to work together on behalf of our shared patients' clients, because sometimes what those medical professionals do actually help us get the better legal outcomes. They might write the information that's going to help that child get a better IEP. They might provide a medical opinion that someone is disabled and therefore eligible for Medicaid.
Are there any grants that support the medical partnership?
We have had dedicated grants, typically to help us get started up. Sometimes we'll write the grants and make sure that our health partners are part of that. And then over time, as our program has evolved over the last 12 years, our health partners have begun to build us into their grants. And then I want to say it's an important moment in the history of North Carolina. The state of North Carolina is really moving toward this idea of ensuring opportunities for health. And those opportunities for health are driven by something they call health equity. And health equity is really about making sure that everybody has a fair and just opportunity to be as healthy as possible. And that requires removing obstacles to health, like discrimination and the lack of access to good jobs and housing and being in safe communities and quality education, the very things that we've always done.
I see. Ms. Morial, one last question. In addition to providing direct services to the people that are referred, do you do also community education?
We do. We provide information about our services that can be shared by our counterparts in the clinical settings, because sometimes people want to know about our Know Your Rights classes in their communities. Sometimes people in the clinical settings may be talking with a patient who's not quite ready to be referred but wants some basic information. But a lot of our capacity building is really with other professionals so that they understand when we should be on there, to use an old person's term, on their Rolodex.
I see.
Yeah.
Well, the information you have provided us is very useful, very important. I thank you very much for being here with us, and I hope that you continue that good work.
Thank you for your time.